Hey there, seekers. Before we get into today's episode, I've got a small favor that could make a huge difference. If you find value here and think others could benefit too, the best way to help spread the word is to scroll down and leave us a quick review, whether you're on Spotify, Apple Podcasts, or YouTube. It only takes a moment and it helps us reach more people striving to unlock their potential. Plus, you might even get some good karma. As soon as we got the medication to a correct dose, she was like, I just see the world differently now. I can see where I'm contributing to my relationship difficulties and where my husband is contributing to my relationship difficulties. I can organize my day. I can organize my kids. I can set boundaries. I don't feel overwhelmed. It was like night and day. Welcome to The Self You Seek, a podcast dedicated to helping you unlock your fullest potential through self-actualization, mental optimization, and transformative experiences. I'm Dr. Brendan Doherty, a traditionally trained psychiatrist who has come to realize that while psychiatry offers powerful tools, there's often something more needed to help people truly thrive. In this podcast, we'll explore evidence-based approaches alongside ancient wisdom and modern transformative experiences that push beyond the boundaries of conventional mental health care. Whether grounded in science or supported by compelling anecdotal evidence, these insights and discussions are all worthy of exploration. Join me as we navigate the path towards unlocking your potential and transforming your well-being. And a quick reminder, this podcast is for informational purposes only and does not substitute for personalized medical advice. Always consult with a licensed healthcare or mental health professional if you're uncertain or need guidance. This podcast also does not represent the views of any business or health service I'm associated with. And now for the show. Hello and welcome to this solo episode of The Self You Seek. And today we're going to talk about ADHD. Now, this is the first time I've done a solo episode. I wanted to do it as a trial and see how it goes. So thank you for listening in. I hope that you enjoy this. And we're going to be talking about ADHD. And I know it's quite a hot topic, both in my life as a psychiatrist, particularly in my life as a psychiatrist, but also you just see it. It's all over Instagram. It's all, people are just always curious about whether they have ADHD or not. So I wanted to talk more about that. And just another reminder that, this is not medical advice. It's, medical information, but always, if in doubt, people have their own individual circumstances. And it's really important to get a professional opinion because general advice doesn't necessarily apply to the individual. It can help the individual, but the only way to really tell is to get an assessment. So I recommend at least get advice if you're unsure. Hopefully this podcast can help a little bit with that. And there's also huge amounts of other resources out there on ADHD. Hope to talk a bit about personal insights today, a bit of my professional perspective, and contribute to the broader discussion on ADHD. And I want to emphasize that ADHD is really complex. There's multiple contributing factors, and there's no single factor that explains ADHD fully. So, it's good to add. Hopefully I can add to the picture and the complexity here. So my primary experience with ADHD is one as a psychiatrist who assesses people. And I see children, adolescents, and adults. And I typically see people. So I see people across the lifespan. It's obviously more popular now to be diagnosed as adults. There's a lot of adults looking for assessments. And rates in children have certainly increased as well, at least the diagnostic rates. I just want to start out by painting a couple of pictures just to show the range of types of presentations that can occur. Because I know some people tend to lean towards, ADHD is really overdiagnosed and we need to be more cautious and not give out medications so easily. And other people would say, well, it's not diagnosed enough and medications cause a lot of unnecessary side effects. People should be looking away from medications for their treatment. And, both are probably true all at once. That's the reason why you might need individual help. So I remember one person early on in my career who was a woman in her sort of, I think, 40s or something like that. And she came to me and was like, my life's a mess. I can't concentrate. I do hold down a job, but my relationship's not going that great. I'm stressed around my kids. I know I can perform more at work. So did a diagnostic assessment, and turns out she met the criteria, and she wanted to start both psychological treatment and medical treatment. So we started her on a stimulant medication, and her life completely changed. As soon as we got the medication to a correct dose, she was like, I just see the world differently now. I can see where I'm contributing to my relationship difficulties and where my husband is contributing to my relationship difficulties. I can organize my day. I can organize my kids. I can set boundaries. I don't feel overwhelmed. It was like night and day. So you hear stories like this actually quite frequently. And as a psychiatrist or mental health professional where a lot of things are necessarily treatable, ADHD in its purest form is eminently treatable, and medications really do help people sometimes. Now, they're not a panacea though. So other people have come to me wanting to try medications. I can be sometimes hesitant about it, or sometimes I encourage it. Ultimately, in this case, I agreed to treat a teenage boy with stimulant medications. And from the outset, he had an increased anxiety. He didn't perform any better in school. It made him, not feel like himself. And so, despite his keenness to be treated with medications, ultimately it was decided not to do that and pursue psychological treatments and revisit the diagnosis. So those are just a couple of examples of where, things can sometimes work out for people and sometimes they don't. There's no one size fits all. So I'd like to just briefly touch on how ADHD is diagnosed. So typically, someone will go to a primary care physician or a psychologist and say, oh, look, I feel like I have inattention, or I am hyperactive, or I'm impulsive, and I'd like to be checked for ADHD, of course. And there are generally like basic screening forms that people can use. And then they will refer typically to a pediatrician, a psychiatrist, or a psychologist to do a more in-depth diagnostic assessment. And that diagnostic assessment typically involves an interview. It involves then the use of rating scales. And then it often will involve a second appointment to look at that. In the diagnostic criteria, it's a really important point. These symptoms must be present in more than one environment. So they must be present at school or work, and at home, or in social settings, or in some sort of other setting. So we know that it's not just to do with the environment that someone's in. So some young people can't concentrate at school, but they're perfectly fine around their friends or at home. So in that case, it's probably more about the education that they're receiving, might not be a good match, or the educational style of the institution. So that's less likely to be ADHD. Or some people might find that at home, their family or their partner is kind of saying, you never pay attention. Maybe you need to get checked for ADHD. Well, maybe, but if it's just happening in that environment, and at work or school, everything else is completely fine and no one mentions that, then maybe it's about the environment at home. Maybe it's about the relationships, or how that person is in relationships, or how people are to them, that warrants closer observation and assessment. So that's a really important part of the clinical criteria. Another criteria that's really important is that there must be some evidence of these symptoms before the age of 12. So this is typically a lifelong disorder. Yes, as the brain matures, they talk about sometimes these symptoms get better, and a lot of people find that they need treatment as young people, but not as adults. But there needs to be some sort of evidence that the person, even if they're going for an assessment in their 40s, 50s, or beyond, had some symptoms of ADHD when they were less than 12 years of age. So that's really important. And typically to get that, you need some sort of objective evidence typically. So school reports, or reports from parents that can let you know what happened, or friends even, that can be quite useful. Now, objective evidence is pretty useful too. So we do know that some people will try to skew the information because they just want to try the medication, or they just want to use it for some other reason. So having some sort of objective evidence, that's why something like school reports are quite useful in this case. I try to trust people. But also it's important to do due diligence. And, often people will do a proper assessment as well. People will sort of see the world in one way, and it's useful to get someone else in someone's life who understands, them even better than themselves, and they can give a more objective opinion. And that's why sometimes rating scales that are given to partners or parents or teachers are often very useful in the diagnosis of ADHD. So those are a few points around the diagnosis which are really important. Often, diagnostic assessment can be done by a clinical psychologist if they want. If the person wants more medical treatment, then often they'll be handed to a psychiatrist who will sort of do a bit of a reassessment and then potentially treat with medications. Another thing around diagnosis that I wanted to mention is that this is a clinical syndrome, right? So there's really no psychiatric or mental health condition that you can do a blood test for, you can do a brain scan, or you can look at a particular genetic presentation or genetic profile and say, okay, you've got, depression, anxiety, schizophrenia, whatever it is, ADHD, autism. All those things are syndromes, so they're a collection of symptoms. And that points to the complexity in different presentations, and also that, these things are not necessarily like, it's not like red is red. We can't just say definitively that it's red. It's much more complex in that we can say it looks like red because it has these different things, but it's not necessarily a pure construct. It's very messy. And that's why doing a thorough assessment is really important, and why looking at also comorbidity is really important. So in the assessment, any good assessment should involve an assessment of comorbidity. So is there a component of depression or anxiety or bipolar disorder or something like that, or personality vulnerabilities that are contributing to this person's inattentive symptoms, their hyperactivity, or their impulsivity? And I haven't really gone through the different types of symptoms that people have, but there's sort of lists of inattentive and hyperactive symptoms, things like, being disorganized or losing your train of thought, or not being able to procrastination, not being in places on time, asking people to repeat things multiple times. That's in terms of inattention. And then hyperactivity are things like, blurts out things inappropriately. Impulsivity is really part of that cluster. Interrupting people, feeling like that they're driven by a motor. So people with hyperactivity obviously have a lot of energy as well. The key thing with all of this is that you can have all of these symptoms, but if it's not really impacting your functioning, and this is the same for all mental health diagnoses per se, if it's not really impacting your functioning at school or at work or at home, then it's not really a diagnosis, right? Because that ultimately, the most important thing is that you are a functioning, healthy, happy human being. So it's really important also to do some sort of functional assessment to make sure that it is actually impacting. And it's not necessarily a perception. Like, some people can often have very negative perceptions of themselves when in fact they're actually doing pretty damn well. So those are some pretty important parts of the assessment process. So this is a good time to mention the sort of normal variance of inattention or hyperactivity. So it is just a normal thing to have difficulty with attention at certain times and in certain places, particularly with certain environmental cues. Like, if you really don't like mathematics and you're in a maths class, you're probably going to have trouble paying attention. Or if you really don't like certain social situations, or you're having a difficult time, or you're just down, it can be very difficult to attend to things, and you can be very low energy at those times. And that can look like inattentive symptoms. So, it's very important to realize that there are limits to what we should classify as something that's actually needs medical treatment or non-pharmacological treatment. At the same time, a lot of young people just do have a lot of energy, particularly young boys, but girls as well, of course. And that energy can be, channeled in different ways. So often what is high energy shouldn't necessarily be seen as ADHD. But of course, there's that threshold. And if it meets all the other diagnostic criteria, then yes, it certainly can. And particularly if it's impacting someone's functioning and they lose their ability to be socially appropriate because of that energy. And it's important to know that there's no single cause for ADHD. I'll probably touch on this a few times. It is thought to be, there's thought to be a large genetic heritability component. Some studies would suggest that it's about 70 to 80% actually. It can be quite difficult to separate, even in twin studies, the degree of genetic heritability just because of epigenetic factors in utero, etc. But there is thought to be quite a high genetic component. The other side of the coin is that it's also can be environmental. There are risk factors such as high air pollutants, lead, potentially low birth weight and prematurity. Those are often found as risk factors. And there are other theories around, I guess, trauma. And certainly, I work with a whole bunch of populations, but one of the populations I work with are quite socially disadvantaged, young people in custody. And there is certainly a huge amount of young people who would meet criteria for ADHD in those areas. And so that begs the question, what's the reason that the levels are so high? I think the purported levels in these populations are, 30% or even more. In some of the populations I work with, I would say it's even higher than that. Now, there is the theories such as what Gabor Mate, the Canadian-Hungarian psychiatrist, would say that as a young person, if you're subject to environments or situations where you have feelings that are intolerable and those feelings are unable to be held by the primary caregiver, then it's a natural, adaptable defense mechanism to distract yourself from that feeling. So you think of something else. And then that happens over and over again. And so someone learns to be distractible because they've constantly got these really quite intolerable negative feelings and no one to sort of sit with them and hold them. And then they learn to distract that to move on to the next thing, And so they're not really able to sit and concentrate and hold their attention on one thing because they learn that's the way to operate. Just keep distracting yourself. Now, my personal opinion is that, again, it is difficult to disentangle all these features, and in socially disadvantaged people, they also may be present to more environmental toxins, more air pollution. So this could certainly be part of it, and lower levels of nutrition that impair brain development. But I do think that there is also a part to play in this inability to hold one's feelings. Like, I don't know, and his theories are actually quite contentious around some areas. But look, I don't think that there is, arguably, not even too much merit to thinking about where these things come from unless you can change that. It's more helpful to just see if these symptoms are impacting someone's health, to make sure that they're not due to something else, diagnose ADHD, and then think about the best way to treat it. Now, there is a question that's hotly debated around whether ADHD rates are increasing. Now, what's not debated is that the number of diagnoses are increasing, and that's across the lifespan, so in children's, adolescents, and adults. In particular, the rates of diagnosis are increasing in females, adolescents, and adults. Whereas before it seemed to be very much a childhood disorder, many people now are diagnosed with adult ADHD, as well as ADHD later in their teens. We don't know, and many studies would suggest that the actual rate of ADHD is possibly just the same, even with current cultural influences on our attention, such as the use of iPhones, which I'll address in a second. But supposedly, when the same standards of diagnosis and rigorous standards of diagnosis are being used, the actual rate of ADHD has not changed. It's just that we're probably picking it up more in certain populations. There's been a lot more awareness of ADHD in recent times. In fact, in my psychiatry training, we really didn't even touch much on ADHD, and I was trained quite recently in the 2010s. And yeah, really, we focused more on depression, bipolar, schizophrenia, psychotic disorders, anxiety. But unless you were in very specific type of training program, towards the end of your years, you might be training in private hospitals, you wouldn't typically have exposure to ADHD. Now, I did training in child and adolescent psychiatry, so we did have some exposure to that, but that was really only in in my final year of training. So, but now more and more so, there is a push within the community to integrate ADHD diagnoses into more public mental health services, but it hasn't had so much of an impact. Now, the other thing is it can be the medications that are used to treat ADHD are quite restricted because they can be drugs of abuse. So that's often withheld certain practitioners from actually doing more ADHD assessments and diagnoses. But those restrictions are decreasing. And so as there's more awareness and more public push for this and more, I guess, understanding that ADHD occurs across the lifespan, the rates of diagnosis are certainly increasing. And I think in certain populations, they've doubled in previous decades. So it's quite an impressive raise. There is also this interesting issue of increased pressure from parents to they want their children to perform as best as possible in school because that sets them up for life. And when they notice small amounts of educational difficulty, there's often an early push and more awareness now to get an assessment for ADHD and potential treatment with stimulants because a lot of people use these medications even when they're not necessarily needing it for ADHD because it can create, give you long levels of attention. Now, we would say that's, unsafe and an improper use. It's more like a performance enhancing drug. And the reason it's not a great idea is because it does have side effects and it certainly, it might reduce access to people with ADHD and it can stigmatize the use for people with ADHD as well. Another reason for increased diagnosis is probably around the medicalization of behavioral problems. And that's the age-old sort of discussion about whether particularly children or adolescents are mad or bad. Now, behavioral problems come in many forms, and we also have these diagnoses like oppositional defiant disorder and conduct disorder, which are a medicalization as well, coming from a more, I say, empathic approach that these things can be caused by adverse childhood experiences and particular environmental issues and even genetics, of course, lead to one's behaviors. And so it's not without good reason, but the increased medicalization has led to people seeing these things more as a medical condition and with a more empathic and holistic treatment approach, as opposed to just saying that someone is bad and has bad behavior and needs to be punished, a little slap over the wrist and keep concentrating in school or whatever, to more saying, okay, well, what can we actually do from a treatment perspective to treat this person's bad behavior? And one of those things is treat the ADHD because there is a high correlation between bad behavior and ADHD. So just touching on the treatment strategies for ADHD, there's really pharmacological and non-pharmacological treatment. I'll talk a bit more today around the pharmacological treatment or the general approach, and perhaps in another episode can talk about the non-pharmacological because there's a lot of options. As a big generalization, but the evidence shows that in general, someone should engage, if they are diagnosed with ADHD, a combination of pharmacological and non-pharmacological approaches, such as therapy or coaching or different types of behavioral or parenting approaches. Now, the reason for that is because we don't know exactly where the gains will come, and each type of treatment has sort of benefits in different areas. So medication, particularly stimulants, treat the core symptoms of ADHD, such as the pure inattentive symptoms or the hyperactivity or the impulsivity, better than the non-pharmacological approaches. However, the non-pharmacological approaches typically treat one's quality of life and functioning better than the medications. So, as you can imagine, both of those things are really important and can lead to improvements in one's self and their ADHD. So, we tend to recommend both. In fact, I will always say if you are on a medication, you should probably always be on a non-pharmacological treatment as well because they work in tandem. Typically, like a medication is not going to necessarily give you the coping skills and the internal understanding to really adapt your life to having ADHD. So it's really good to have some sort of therapy or an outside perspective and things to practice to improve your ability to concentrate and hold attention and ability to manage all that energy or impulsivity as it may be. And reminding also, just touching on the fact that ADHD, just like many mental health conditions, can actually be in some ways a superpower. And it's really important for people to understand that. So in a modern world, actually having, being able to set shift between things really quickly can be really important. We know that multitasking is not necessarily a great thing, but being able to do that to some degree can be very useful. And if you can harness those abilities and that increased energy, can be very useful. And a lot of people with ADHD will have just huge amounts of energy, and being able to use that by helping other people, or creating content, or being productive at work or home, can be super useful. So that, and also people with ADHD will often say that they feel very creative. So utilizing those creative impulses can be a real superpower for people with ADHDs. And part of the treatment is actually to identify those areas with someone who's an expert in that, and help them come to a realization that to use those things for good, rather than being worried about how it's negatively impacting your life. In terms of the medications, there are two general categories. There are stimulants and non-stimulants. So stimulants are the first line treatment, and that's what typically people would understand as being Ritalin or dexamphetamine, and both of those things come in long-acting versions. And the shorter-acting versions, people sometimes like for convenience, but in general, people will want the long-acting version because it will treat them for the whole day, the symptoms for the whole day. Now, the problem with stimulants is that there can be a lot of side effects, and that's something to really take into consideration. People don't necessarily feel themselves. There are some important heart or cardiac side effects to take into consideration. They can inhibit appetite and hence growth. If taken in excess, they can sometimes make people psychotic. There's all sorts of things that people need to be aware, and they are, of course, can end up being drugs of dependence. So in that case, people can feel like they can get addicted to them. And so that's one of the reasons why, for instance, we recommend drug holidays where people don't actually take the medications to reduce that tolerance, amongst other reasons. Now, if someone's not appropriate for a stimulant medication, and by the way, when stimulant medications work, they really work. So if you have provided they're given the right dose, you can have a miraculous response. They don't take time to really build up in the system. You can give them in that day. Someone feels like they're a new human being. So it can be quite miraculous when it works. But all those side effects are also dose related. So it can be that as a prescribing doctor, the balance can be really in getting enough efficacy, so enough effect from the medication, but not getting too many side effects where someone is not really feeling themselves, or it's, say, exacerbating something like anxiety. Where the stimulant medications aren't appropriate for whatever reason, there's non-stimulants. Those are mostly something called atomoxetine and guanfacine and clonidine. They can be quite useful. They definitely don't have as much efficacy, but they are more appropriate for certain populations. I certainly use a lot of guanfacine in younger people in the justice system, and I think people with behavioral disorders. And it's also very good for where people have concomitant trauma symptoms or impulsivity issues. So that's the general medication treatment and non-medication treatment. Now, as well as the non-pharmacological treatments that I discussed, like cognitive behavioral therapy that would typically be done with a psychologist, behavioral interventions, ADHD coaching, these things all have a lot of evidence and might go into them more in another time. It's also really important to think about lifestyle factors. So things like diet, sleep, and exercise. Now, again, these can simply be reasons for inattention in themselves, but the brain is a complex beast. And in order to be working well, there's all sorts of things that need to be firing. So it's got to have nutrients, it's got to have good blood flow to the brain, which is where exercise helps, and it's got to be well slept. So the sleeping is where you get a lot of sort of the cleaning and maintenance done in the brain. If you're not sleeping, then the brain's really not able to. It's like a dirty house. If there's stuff everywhere, then you can't really operate in the house as you would like to. So really paying attention to diet, and particularly having nutritious, healthy foods that have a low GI. So they're slowly releasing carbohydrates, the energy for the brain, super important. And exercise, so really anything that someone can do, but walking or some sort of cardiovascular exercise can really help the brain operate more effectively and help people concentrate. Personally, I found when I started to do yoga, particularly hot yoga, when I was an intern, I found that extremely helpful with concentration. I don't know if there's evidence around it, but I certainly found that useful and still do. It helps with sleep as well. And then, optimizing one's sleep environment is very important for people with ADHD. Also, creating structure. The brain likes to know what to expect. So if it knows that it's working at a certain time and a certain place every day, it's more likely to operate more efficiently if it does that day on, day out. So it likes routine and it likes structure. So that can be super important for ADHD as well. So as you can see, treatment has a lot of facets, and it's really important to take a broad perspective into treatment, including pharmacological and non-pharmacological and more holistic and lifestyle factors as well. And really that's going to be best done in combination with a treatment provider that can give you more expert advice on what to do. Just in summary about what we've spoken about today, I wanted to just go over the key points. That is that ADHD is a complex, what we call neurodevelopmental disorder. So it starts early in life, and it can affect one's inattention, one's energy levels, so hyperactivity, and also impulsivity. And we tend to diagnose either inattentive ADHD or hyperactive impulsive ADHD or combined ADHD subtypes. Now, not all things that involve those symptoms are ADHD, and that's why it's important to do a really thorough assessment, because it can be both a normal variant, but it can also be a symptom of another mental health or medical condition. Something like even anemia can cause inattentive issues. So it's really important to get a thorough assessment with a highly qualified individual to assess all these things to make sure that you're not missing something or treating it inappropriately. And I have seen that, so it's really important to look at that. When it comes to thinking about where did that ADHD come from, look, there are a lot of theories. There's no single cause for ADHD, and in probably almost everyone, it's multifactorial. We do know that there is a high level of genetic heritability, but we also know that there are quite a lot of environmental factors that can contribute to ADHD. When it comes to treatment, what's best is an approach that's individualized and usually involves a combination of pharmacological and non-pharmacological approaches, and to really be individualized to the person so that they're getting the most appropriate treatment. And as I said, typically medications will treat the core symptoms of ADHD, but non-pharmacological approaches are going to be better for functioning and quality of life. And that's about it, folks. I really hope that you enjoyed this solo episode of The Self You Seek. I would be interested to hear any kind of feedbacks about whether this was useful. I look forward to doing it more in the future, and I could go into more detail about, for instance, non-pharmacological treatment. If you would like more of this kind of content, please let me know, as always, and I would love it if you found value to subscribe to this channel, and particularly even leave a review on whichever platform that you use. That's very useful. But until next time, thanks for listening to The Self You Seek. Have a lovely day. Thanks for tuning in to The Self You Seek. I hope today's episode brought you one step closer to unlocking your full potential. If you found value in this conversation, I'd love it if you could take a moment to rate and review the podcast on your platform of choice, whether it's Spotify, Apple Podcasts, or YouTube. Your feedback helps us grow and reach more people on their journey to self-actualization and mental optimization. And remember, this podcast is just the beginning. It's meant to inspire and empower you, but it's no substitute for personalized advice. If you ever need guidance, always reach out to a licensed healthcare or mental health professional who can support you on your unique path. Until next time, keep seeking, keep growing, and take care of yourself. I'll see you in the next episode.